Dr. Anita. Following Sarah's talk on respiratory distress, I wanted to discuss a little bit more two problems today, two problems with breathing in neonates. One is transient tachypnea of newborn, and the other one is respiratory distress syndrome. We'll talk about transient tachypnea of newborn today, respiratory distress syndrome. We'll talk about this during the next recording. Those two entities have different mechanisms and are most common reasons for problems with breathing in neonates that require admission to neonatal ICU. Transient tachypnea of newborn affects babies that are born near term or even at term, and it's caused by the late absorption of fluid from baby's lungs. When baby is inside mom, everything is filled with fluid, including lungs. When mom is approaching due date, some of that fluid, about 30 to 40% of that fluid, is being reabsorbed from baby's lungs. The fluid starts to be reabsorbed even 1 to 2 days prior to delivery, and then when mom goes into active labor and delivers vaginally, another 30% of fluid is being reabsorbed from baby's lungs, even before baby is born. It's not only mechanical forces that squeeze that fluid out of baby's lungs, but also some hormones during active labor and delivery that play role in that reabsorption. Now, when the baby is born, there is still some fluid in baby's lungs, about 30%, that needs to be reabsorbed after baby is born. With the first breath, when the alveoli, air sacs, open up and baby starts to breathe, the fluid is further squeezed out of baby's lungs. Then the remaining fluid is being reabsorbed through lymphatic vessels to baby's bloodstream. In some babies, for some reason, it takes a little bit longer for that fluid to be reabsorbed, and babies have problems with breathing. That is called transient tachypnea of newborn, TTN. Who gets transient tachypnea of newborn? Transient tachypnea of newborn is more common in premature babies because their lungs are not fully developed, they are immature. Transient tachypnea of newborn is also more common in babies that are born, for example, via scheduled C-section, when mom doesn't go into active labor. And in this scenario, we are missing that first phase and second phase when the fluid is being reabsorbed from baby's lungs even prior to delivery. Transient tachypnea of newborn is more common, for example, also in babies that are born via precipitous delivery. What are the signs and symptoms of transient tachypnea of newborn? Babies that have TTN, they breathe very fast. Babies in general breathe much faster than we adults do because we breathe about 12-15 times per minute. Babies usually breathe 40 to 60 times per minute, but babies that have problems with breathing, that have TTN, they can breathe as fast as 100 per minute or even over 100 per minute. Then those babies make noise when they exhale. We call this noise grunting. When they breathe, they may use accessory muscles. You can see skin pulling in between the ribs or under the rib cage. And those babies will have low oxygen saturation, so oxygen content in their blood. Transient tachypnea of newborn, it's called transient because it usually resolves quickly within 24 to 72 hours of life. But those babies, before they get better, we need to provide them with some respiratory support and nutritional support. How do we treat transient tachypnea of newborn? We need to provide those babies with oxygen. And how do we give it? How do we give oxygen? The first option is nasal cannula. It's plastic prongs that go to baby's nose and blow some air and oxygen through baby's nose, supporting their breathing. Sometimes babies with TTN need more support than nasal cannula, and we need to provide them with something that is called CPAP. It's a little bit bigger device. It usually goes through around baby's nose, and it's more pressure with oxygen that is blowing to baby's lungs and keeps them open and prevent collapsing of alveoli, those air sacs. Because babies with transient tachypnea of newborn are breathing very fast, they are not able to suck. They are not able to suck, swallow, and breathe at the same time. That's why we have to provide them with some IV nutrition. We sometimes have to give them something that is called also feeding tube. It goes through baby's nose or mouth. It's a plastic tube, small one. It goes directly to baby's stomach, and we take mom's milk or formula and we inject it through that tube, nasogastric or orogastric tube, directly to baby's stomach. Many babies start to get better within 1 to 3 days, as I mentioned before. They will start to breathe easier, they look more comfortable, they need less oxygen, they regain appetite, and usually 24 to 48 hours after discontinuation of respiratory support and oxygen, as well as IV nutrition, they are ready to go home. If there is any questions regarding transient tachypnea of newborn, please contact me. You can find my email address, my contact information on our website, neonatologyforparents.com. Thank you.